Hi, I am Dr. Rajesh Iyer, consultant neurologist at Vikram Hospital, Bangalore, and I am associated with the MSSI Bangalore chapter for more than 15 years. MS occurs because of an aberrant reaction in your immune system which affects the brain, the spinal cord, or the optic nerves and leads to various symptoms of disease of these structures in the nervous system. Typically, the disease manifests as blurring of vision, double vision, or imbalance while walking, or tingling or numbness in the upper or lower limbs, and sometimes bladder issues. The diagnosis is made based on the clinical symptoms and an MRI scan, and rarely we do a lumbar puncture to confirm the diagnosis. The most important factor in MS is early diagnosis and early treatment because if treated early, many of the disabilities due to MS can be prevented. Typically, the disease follows a course of remission and relapses wherein symptoms seem to come and go, but actually the disease process is a continuous disease. Therefore, it becomes very important to have an early diagnosis so that early treatment can be started. Those patients who receive treatment very early into their disease generally don't develop disabilities in the long run. Untreated, almost half of the patients with multiple sclerosis go on to develop disabilities in 10 to 20 years. There are various types of treatment or medicines available now in our country. And if the appropriate medicine is chosen and initiated early, most of the people can do their routine work and lead normal lives. Of course, it is important to monitor therapy and see if somebody is responding very well to treatment or not. We use a guideline called NEDA, that is no evidence of disease activity, wherein once we start on treatment, we would like the patient not to have any more recurrences of symptoms. There should not be any progression of disability, and the MRI scan should not show any new lesions. If if these criteria are satisfied, then the treatment becomes quite successful, and we can prevent further damage happening in the nervous system. What we see is many people do Google or other searches and get scared about MS. It's not so. There are various types of MS. In fact, there is a category of MS called benign MS, wherein in spite of having the disease for 25 to 30 years, patients don't develop any disabilities or any major issues. So, and many people with benign MS don't need treatment as well. And we have got drugs which are classified as first line drugs, second line drugs, third line drugs, and generally we start off with a first line drug, and if the symptoms progress, we always have options of going ahead with the second line drug. And of late, the treatment costs of MS has also come down remarkably, so that it is affordable by many people. Now, of course, there are simpler therapies also called immunosuppressants, which we may still use for people who cannot afford any of the therapy. So the bottom line statement is that if you have diagnosed, if you are diagnosed with MS, then it's better to be on some kind of therapy, and there are various medicines to choose from. But the importance is that be on therapy and get yourself monitored regularly. Do well with MS. Don't get scared. All the best.